Hello, welcome back. In this second video lecture, we're going to focus on contingency planning, disaster recovery, and the role of security officers and other related topics. We'll also get into the high-tech law, forensics, audits, and other information. Let's get started. And again, we talked earlier about individuals having the right to request amendments to the records. They may require the amendment request to be in writing. That's certainly okay. The facility either may accept or deny the request, and a timely response to the request by the covered entity is set at 60 days under the HIPAA privacy rule. And again, states may have more restrictive measures, they can't make it longer than 60 days. Individuals have a right of accounting of disclosures. What this means is I can request who has viewed or had access to my health information. And this period typically covers the previous 6 years. Many disclosures do not require an accounting. And again, anything for treatment plan operations, we don't have to disclose. Things that are needed to meet national security investigations or intelligent requirements, again, don't need to be disclosed. Giving PHI to a correctional penal facility, for the most part, under the HIPAA privacy rule, does not need to be disclosed. Disclosures that are included in accounting must include any mandatory public health reporting pursuant to a court order or any erroneous disclosures. Patients have the right to the accounting of all disclosures. So what needs to be in the accounting? The date of the disclosure, the name and address of the entity or person who received the information, a brief description of what the PHI that was disclosed, and a brief statement saying what was the purpose of the disclosure or copy of the individual's written authorization or request. And again, the first accounting in a 12-month period is free. Individuals have the right to request restrictions to their PHI. All right, the covered entity may permit a request, but does not have to agree to the requested restriction. Here's an exception to that. They must agree if the disclosure would be to a health plan for payment or operations, but the provider has been paid in full by other than the health plan. And individuals have the right to request confidential communications. So in other words, alternative routing or destination or by an alternative method. Individuals have the right to complain about privacy rule violations, right? And in the privacy practices, if you've received one recently, individual patients are informed of their right to complain at the covered entity level and also to the U.S. Department of Health and Human Services. And all these complaints and their disposition, in other words, what happens to them, must be documented. Again, there's always a notice of privacy practices that we give patients, and this explains how an individual's PHI will be used and disclosed. It's available of notice, has to have required content, and it needs to be signed and acknowledged by an individual, as we all know. When we talk about consent, we're talking about signing an agreement to use or disclose PHI for treatment, payment, and operations. This is an optional document and it can be revoked. The authorization grants permission for a specific use or disclosure of PHI. It is required as a general rule, but there are many exceptions. And again, these also may be revoked. So things when authorizations are not required. In other words, when we require use and disclosure, this would be anything for access or accounting of disclosures requested by an individual or their personal representative or the U.S. Department of Health and Human Services for any type of investigation or enforcement act. In other words, if the Department of Health and Human Services is investigating some sort of fraud and abuse and they need to review records, they don't need to get a signed authorization for each patient's record they review in these cases. Authorization is not required under certain types of issues. The patient has the opportunity to informally agree or object to being included in a facility directory of patients. Sometimes people, when they're in the hospital, they don't want visitors. They have the right not to be listed. So when somebody calls hospital operator, they do in fact have the right to say, I don't want to have my name listed. They also have the right to notify or not their family or friends. Patients do not have the opportunity to agree or object and must not violate a stricter or more protective state law. So again, it's helpful to think about these items under the HIPAA privacy rule as being the bare minimum. Other states may have even more restrictions. And some of these restrictions include such things as treatment payment operations, disclosure to individuals, incidental disclosures, and limited data sets. So again, think of the HIPAA privacy rule as a minimum federal standard. Other states may be more restrictive under certain circumstances. More on authorization being not required for these 12 purposes. If they're mandated reporting, public health activities, any victims of abuse, neglect, domestic violence, healthcare oversight activities, administrative proceedings, law enforcement, decedents, cadaveric organ, eye, or tissue donation, research, threat to health and safety, specialized government functions, workers' comp. Typically, these do not require authorizations. And again, disclosures of students' immunization records is considered a public health disclosure, and therefore a written authorization is not required. With research, it gets a little bit more complicated. A covered entity may combine authorization for use and disclosure of PHI with an individual's consent to participate in a research study. That's why when you join a research study, frequently, just to be extra safe, they'll have all this spelled out in the authorization that gives you the risks, benefits, and what have you of participating in a research study. If research-related treatment is conditioned on providing one of the authorizations, this is permitted if the compound authorization differentiates between conditioned and unconditioned components. Now we get into things that are in the news a lot, breach notifications. Breach notifications is a required mitigation method for breaches of PHI. It covers both covered entities and business associates. So if a business associate has a breach, they need to notify the involved individuals, right? This also applies to covered entities. Others, such as these little software applications, you can put your personal health information on these personal health records. They're subject to the FTC regulations. As the vendor may not be considered a covered entity under the HIPAA privacy rule. So what is a breach? A breach is any unauthorized acquisition, access, use, or disclosure of PHI which compromises the security and privacy of the PHI. Breach notification applies to unsecured PHI only, which technology is not made unusable, unreadable, or indecipherable to any unauthorized personnel. So encrypted PHI is okay. That's why more and more healthcare organizations that are issuing laptops always make sure that the laptop itself is entirely encrypted. A breach presumes the following. Breaches presume following any impermissible use or disclosure unless there's an exception or low probability of compromise. So the fact is, if you have, as an organization I know of in California, if you have a website that has some PHI on it and the PHI was not secured and had minimal security, it's assumed a breach, even if you don't know that somebody had gone in and looked at it, right? The only way we assume that it's not a breach is if there's an exception or a very low probability of somebody accessing it. There are some exceptions to breach definition. So if people have an unintentional acquisition, access, or use of PHI by a workforce member who is acting under the authority of a covered entity or business associate, meaning that they unintentionally accessed it and the information wasn't further used or disclosed, may not be a breach. Any inadvertent disclosure of PHI from a person at a covered entity or a business associate to another person authorized to access PHI is not considered a breach. However, if the covered entity or business associate has good faith belief that the unauthorized individual who received it would not be able to retain it, may not also be a breach as well. So when we talked about the probability of compromise, it's determined by four-factor risk assessment. First one is the nature and the extent of the PHI, including the types of identifiers and how likely it is that the re-identification can occur. Then it's who the unauthorized recipient was. And then finally, whether the PHI was actually obtained or viewed, and the degree to which the covered entity or business associated mitigated the risk. With notifications, you must notify affected individuals without unreasonable delay and no more than 60 days from when it was first known or should have been known. If it's 500 and more individuals, media outlets must be notified through public channels, and the Secretary of the Health and Human Services must be notified. All breaches less than 500 patients being affected are reported to Health and Human Services using an online tool, and it's submitted no more than 60 days after the end of a calendar year. Let's talk a little bit about commercial uses and disclosures of PHI for marketing, sale of information, and fundraising. A general rule is that the use or disclosure of PHI for marketing requires authorization. So, in other words, if we're going to send things out to people for certain types of marketing, right? Aiming for products that would be useful for cancer patients or what have you, that generally requires an authorization. And if there's any remuneration to the covered entity, this also must be disclosed. We covered a lot of ground, but we have one more video lecture where we're going to hit on other topics related to data privacy and security, such as medical identity theft. So we'll see you then. Bye now.